Well, many health conditions have a genetic link, and genetic testing can help if you have an increased risk for developing cancer in certain conditions. In fact, genetic testing can estimate your chance of developing cancer in your lifetime. And here to help kind of explain what all of this means is Baptist Health OBGYN Dr. Brian Burton. Thank you for being here.
Absolutely.
So let's talk about this new genetic testing.
Yeah.
First of all, what is it for no one who's heard of it, and
Absolutely.
how does it help?
We all know that there's family histories of certain types of cancer, like breast cancer or ovarian cancer or colon cancer. Now we can test to see if you actually carry a gene mutation that increases your risk for those cancers.
Okay.
So, and it's a simple blood test. You go in, you talk to your doctor, and see if you meet criteria. And if you do, then we draw your blood, we send it to a lab, and it comes back with kind of a yes or a no. And it gives us a lot of information on how we can counsel you.
So have you seen an increase in patients wanting this done because maybe their mother had breast cancer, grandmother, etc.?
Absolutely. I take care of one family that had this horrible gene mutation for gastric cancer, and all of the people in that family have had their stomachs removed, and now they're having babies and they're doing fantastic, and they would otherwise not have been alive. Right.
Wow.
So, yeah, it makes a huge difference.
So it's preventative care then, essentially.
Yeah.
And so who should consider getting this done?
I think, you know, the biggest problem we see right now with it is that it's great information, but insurance companies don't necessarily want to pay for it, right? It's all well and good if it's affordable.
Sure.
And so getting insurance companies to pay for it is the thing. And so the biggest driver of that is what is your family history, right? So if you meet criteria, which these criteria are all outlined for us, then we can send you to a high-risk center. Like, let's say you have a really strong family history of breast cancer, your mom, your aunt, your grandmother, and we say, well, why don't we test you? You come back with a BRCA positive gene mutation, we can refer you to a high-risk breast center like that Baptist has or that Carti has. There's several around the state. And they can plug you in and they can screen you differently. So instead of a mammogram starting at age 40, you might get a screening ultrasound and a breast MRI every 6 months starting at age 35.
Yeah, to catch it sooner because you were predispositioned to develop it anyway.
Yeah.
So other than breast cancer, what else can you look at with these kinds of tests?
Good question. So breast cancer, colon cancer is a big one. We see a huge rise in colon cancer, especially in African-American communities, especially under the age of 45.
Okay.
So breast cancer, colon cancer, ovarian cancer, pancreatic cancer, there are several that we can look at that we see on a regular basis.
Okay. And so what would be the first step for someone wanting to get this done, saying, hey, you know, I had this in my family, what do I do?
Man, I think a conversation with your physician. People are scared that, oh, if I get this testing done, my life insurance is going to drop me, or I'm going to have a problem with something in the future. I think a conversation with your doctor, and if your doctor doesn't listen, go find a different doctor. I mean, you know, I can't reiterate that enough.
Yeah, sounds like this could save your life.
Absolutely, it makes a huge difference.
Thank you so much. It's
You're
Dr.
welcome.
Burton with Baptist Health. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health Healthline at 1-888-BAPTIST.